Okay, hello and welcome everyone. Thank you so much to everyone for joining this presentation. We were thrilled at the turnout that we had. Before we get started here, I would like to introduce our speaker for this evening. Dr. Matthew Tenenbaum is the Associate Medical Officer of Health for Wellington-Dufferin-Guelph Public Health. He provides oversight, support, and medical expertise to staff and community partners. Prior to joining public health, Dr. Tenenbaum worked for several years as a family physician in Hamilton. He completed his residency in public health and preventative medicine at McMaster University, during which he spent time at several health units across Southern Ontario. Dr. Tenenbaum holds a Master of Public Health from the University of Toronto and a medical degree from McMaster University. Welcome, Dr. Tenenbaum.
Thank you very much, Anna, and thank you everyone for being here with us this evening. Can I just do a quick sound check before I get too far into things, Anna?
Yep, sounds great to me.
Thank you. So thanks everyone for making the time. I know we have about an hour together this evening, and I recognize I'm coming to you at a really exciting time when we're able to really ramp up our vaccine rollout in our community, and of course, get lots and lots more people immunized. But I'm also coming to you at a time when there's a lot of information out there about what to expect, information about the vaccine, information about how that's going to impact you, your family, those around you. And so the purpose of tonight is really to try to lay out a little bit of our vaccine rollout, in particular as it affects young people, youth, and give you a sense about some of the ways it's going to unfold in the coming weeks and months, maybe bust some myths while we're at it, and as well address some of the questions that you might have. Again, I know this is a time when a lot of information is changing, and every week it seems like there's some new piece of news or new piece of guidance when it comes to vaccines. But I want to make sure you feel comfortable with the information as it exists right now and have a good sense of what to expect and a good sense of why it's important to get the vaccine as soon as it's available to you or members of your family. So hopefully my slides are showing, and I've just moved ahead to the next slide. So just briefly, while I have time with you tonight, I want to cover three main areas. Number one is talk a bit about our local vaccine rollout for COVID-19, how things have been going and what to expect coming soon. Next, talk about some of the myths that exist around the vaccines. We certainly have heard a lot of them in public health, and I want to make sure we have a chance to talk about some of the things behind those myths and explain the truth to some of those rumors that are out there. And thirdly, I want to make sure we have time for some of the questions that you have as we go into the next phase of the vaccine rollout together, to make sure that you feel comfortable and confident about the vaccines, about how effective they are, how safe they are, and why they're the right choice for yourself and members of your family. So just to begin with our local vaccine rollout. So we've been operating in WDG, rolling vaccines out since January. And of course, back then, vaccines were in pretty short supply, you had very few doses, and we were really prioritizing who got those vaccines. We began with our oldest members of our community, those living in retirement homes, long-term care homes, and the staff in those settings. And eventually, over time, we have expanded the eligibility for the vaccine program as supply has increased and as we've had new products entering the mix. And right now, we're very fortunate to be at a point where we have many, many doses coming in each and every week into our health unit, thousands of doses. And we've been able to, ourselves and with partners, really ramp up our vaccination clinics, make sure those doses get into arms. And of course, over the course of the rollout, the number of people who have been eligible for vaccines has increased, and now we're immunizing everyone all the way down to age 12 and above. And we've been making some really great progress against our local immunization targets. Way back when we were planning the vaccine rollout, we aimed for 75% or more of our eligible population to have at least one dose by the end of June. And as of right now, in the middle of June, we're at about 72% of people having received at least one dose in our community, and just over 10% of people who have received 2 doses in our community. We know that, of course, these doses and these metrics are tied to our broader reopening and are tied to our ability to get COVID under control and get back to normal. And we're really pleased with the progress against these targets. And of course, every single vaccine counts because it means that's one person who has less risk of COVID for themselves and less risk of passing that COVID on to other people around them. When we break this down in our community by age, we can see that as we go from the youngest to the oldest age groups, the numbers look quite different. We began immunizing with those who were oldest, those who are at greatest risk of bad disease and some of the really significant things we can see with COVID-19. And that's why when you get to the people above age 70, for example, we have a 90% coverage rate or more. And as you get further down into ages, that coverage rate is a little bit less because that's as you've been gradually opening up eligibility, we've been catching those groups up. Down towards the left-hand side, looking at 12 to 14-year-olds, 15 to 19-year-olds, we haven't gotten as high up there yet with those age groups because we've only been immunizing some of those folks just recently. It was just recently that Pfizer, for example, expanded its eligibility for its vaccine so that we could go all the way down to age 12. On our end, we view this as an opportunity. We know this is a big group that's going to be critically important to our overall vaccination effort and overall ability to control COVID-19 in our community. And even though those numbers aren't quite as high as they are for the older groups, given the number of weeks we've been immunizing these age groups, we have actually made tremendous progress, and we're hoping to make more progress in these age groups as we move further into the spring and summer, and hopefully the fall beyond it. When it comes to the vaccine rollout, we've been using a few different vaccines you've probably heard about because the names that are on this slide have been in the news. Our two mainstays are the so-called mRNA vaccines, vaccines by Pfizer-BioNTech and Moderna. Those vaccines are very similar to one another. And Pfizer, as I mentioned, was recently approved to go down all the way to age 12. Initially, both of these vaccines were just approved for adults because that was who was included in the initial trials. But Pfizer has done some follow-up studies and they now can go down to age 12 with their vaccine. Moderna, we expect, will go down to age 12 as well because they're currently, they've submitted some data to Health Canada and that approval is likely to come in the next few weeks. And we are hoping that as we move further into the fall, we're actually able to expand those age groups more based upon further studies these manufacturers are doing, and perhaps even be able to offer these vaccines to younger children in our community. We also have had two other vaccines in our tool belt, the so-called viral vector vaccines. One of them, AstraZeneca, is one that we were offering for a period of time. That one's been put on hold because of some concerns about blood clots that are linked to that vaccine. And the other vaccine that we've been talking a little bit about is the Janssen vaccine, also called the Johnson & Johnson vaccine, the single-dose vaccine. And it's of the same category. We haven't actually been using that one yet because we have had some limitations on our supply. But it really is those top two vaccines, the Pfizer vaccine and the Moderna vaccine, that have been the mainstays of our mass immunization clinics. And we've seen these vaccines move out of our main clinics into places like pharmacies and primary care offices. And they are the key vaccines to our immunization effort in our community. I will mention as well that we have a number of other vaccines at various stages of research and approval that are likely to enter the mix in the coming months and years. And there may be options for us as we move down the road. But these vaccines in the slide right now, and especially the Pfizer and Moderna vaccines, are those that are the most important right now. And it's the Pfizer vaccine right now, perhaps Moderna vaccine soon, that's going to be offered all the way down to age 12. In terms of how the vaccines work, so these mRNA vaccines are a new kind of vaccine in terms of our ways we've done vaccination, but it's based upon technology that's been underway for decades. Essentially what the vaccine does, it delivers a little bit of what we call mRNA, a bit of the genetic code of the virus. And it helps train your cells in your body where you get the injection so that they can recognize what this looks like. They can build a little piece of the virus, and that piece of the virus can be recognized by your immune system, which can then build the antibodies and other kinds of memory it needs in order to recognize the real COVID-19 virus if it ever encounters it. The basic principle of training the immune system to recognize what the virus looks like is how all of our vaccines work, even though the actual way we use mRNA is new. Like I say, though, even though it's a new vaccine technology, it has been developed and researched for a long time. And it's likely to actually change the way we do vaccinations in the future, given how effective these vaccines have been. In the initial clinical trials for both the Pfizer vaccine and the Moderna vaccine, they had effectiveness in the trials of over 90%. And those are quite staggering numbers when you consider some other vaccines are much less than that. And we use some of those less effective vaccines to great effect in other contexts like influenza. When it comes to the COVID-19s available for youth, age 12 and above, as I mentioned, is the Pfizer vaccine that's going to be our most important vaccine right now, and perhaps the Moderna vaccine coming up soon. We want to make sure we're able to deliver those vaccines as soon as we can to those in our community who are eligible. Right now, we're saying that for youth, and anyone aged 12 and above, we're asking them to schedule a first dose as soon as possible. We have some dedicated space in our clinics over the month of June for people aged 12 and up in that youth group to get the vaccine. And now that we have such great supply of these vaccines, we want to make sure people are offered the vaccine as soon as possible. The sooner you get that first dose, the sooner your immune system can begin training against COVID-19, and the sooner you can have that protection against the virus if it ever comes about, if you ever encounter it in the real world. And of course, the sooner you get your first dose, the sooner you can get your second dose. And when it comes to the second dose, we are going to be holding appointments to provide second doses to school-aged youth, looking at the first 2 weeks of August. We are going to have more information about that in the weeks to come, including information about how to move up existing appointments if you don't have them in that time block. But as I say, we do want to get everyone immunized if we can in August in this age group, so get as many students as possible immunized before they go back to school in the fall. In terms of how to get the vaccine in our community, if you want to get the vaccine through our clinics, we strongly advise you and recommend that you pre-register for the vaccine. And that's something you can do if you go to our website, wdgpublichealth.ca/register. You can go in there, you can sign up, and anyone aged 12 and above can go in to create that pre-registration. As soon as you go in and do that, you're going to receive a booking code. It may take a couple of days, but certainly within 5 days or less, you should get a booking code in your email. And that will allow you to then go in to actually book a specific date and time for your vaccine appointment. Again, the sooner you get your pre-registration in, the sooner you get that booking code, the sooner you can get your vaccine appointment. And we are really asking and encouraging everyone to do that as soon as possible, ideally this month, so that we can get vaccines into arms earlier and then eventually second doses into arms as soon as we can. There we go. There are, of course, other options to the vaccine in our community beyond our clinics run by public health. We have partnerships with pharmacies and primary care providers. They're now offering these vaccines in different settings. And we encourage you, if you're interested in these options, to reach out directly to your primary care provider or your local pharmacy to understand what vaccine they're offering and when they have appointments available. When it comes to pharmacies, for example, you can go online to the Government of Ontario website at that link there and check out all the locations of pharmacies in our area or closer to your area where they're offering these vaccines for you. And again, we have multiple options in our community. We have our mass clinics, we have primary care, we have pharmacies, all working together to get as many doses into arms as possible so we can get that community level of immunity up and provide protection to everyone who's able to get it. Now, we know people have a lot of questions, especially when it comes to the vaccines and younger people, the youth, age 12 and up. And so we really want to make sure that we give people reliable information that they can turn to, given that not all the information out there is reliable on the internet. We at our website at wdgpublichealth.ca/vaccines have a number of resources. If you choose the link Answers to Your COVID-19 Vaccine Questions on the menu on the right-hand side, you can access our information. And we also have a new frequently asked questions section, specifically about COVID-19 vaccines and youth. We're going to be updating this as new resources that are helpful are available, but we want to make sure we have a one-stop shop for you where you can go with your questions and get answers reliably that you can trust. Now, moving into some questions people have about vaccines, especially when it comes to this age group. One of the questions that commonly comes up is whether or not youth in that 12 to 17 age group need parental consent in order to get vaccinated. And the answer to that is that anyone who gets the vaccine, regardless of what age they're in, and including those in the age 12 to 17 group, have to provide informed consent. That means that whoever's getting the vaccine, that individual person, needs to understand the risks and benefits of the vaccine, needs to understand their options, and be able to ask questions before they actually get the vaccine in their arms. It means understanding what getting the vaccine involves, why it's important to get it, and again, the risks and benefits. So we always collect that informed consent from the person who's getting the vaccine, and that's true regardless of that person's age, and it's certainly true of the youth aged 12 to 17. The next question we often get is the question about whether someone should get 2 doses or just get 1 dose. Of course, all the vaccines we're using right now are 2-dose vaccines. We know that these vaccines require 2 doses in order to provide effective immunity, effective ability to fight off infection. We know from some studies we've been doing over the course of the pandemic that 1 dose of the vaccine does give you some good protection, and is certainly much, much, much better than nothing. And that 1 dose allows your body to begin recognizing what the virus looks like and to give you some protection. But at the same time, with all these vaccines, it's once you get that 2nd dose that you get a stronger immunity and a longer lasting immunity. And so we strongly, strongly, strongly recommend that everyone who gets a 1st dose also gets a second dose when their turn comes, because it will help make sure that that immunity is as effective as possible, as broad as possible, and as long lasting as possible. And ultimately, we only consider you fully immunized if you do get the full series, both doses of the vaccine. We want to make it as easy as possible for you to get the first dose and the second dose when the time comes up. When it comes to getting more information or kind of sussing through the information that exists online, I mentioned that our website is a really reliable source of information, but we know that it's not the only place people are going to go. We know there's information circulating on websites, information in the news, information on places like Facebook and Twitter and Snapchat and other social media. There's a lot of information out there. And some of it is really good, some of it's really current and evidence-based, and some of it is not quite as good and not quite as reliable and may not be as true when it comes to the facts. And so we were trying to talk to everyone who we have a chance to talk to about some strategies they can use to really assess how credible information is when they see it online. And whenever you see something online and you're not sure whether it's true or not, you're not sure whether it's reliable or not, there are a few questions you can ask yourself to help understand how you should rely on this information. Looking, for example, at who wrote the information online. Do you know who they are? Do they have a name attached, or is it anonymous? Are they experts? Do they have credentials? Are they qualified to speak or write on the topic? That's an important question. Ask yourself also, who are they writing for? Are they writing for the broad audience? Are they writing for a technical audience? And how are they framing the information in light of that audience? Ask yourself what the purpose is for that person to share information. Are they trying to share some up-to-date research? Are they trying to share information because it's meant to inform your actions? Is it information shared for entertainment? And looking at the purpose of the sharing the information helps you understand how to contextualize it and helps you understand whether you can or should rely on it. Of course, looking at how reputable the source is critically important. Is this information that's being published online in a place that's really credible, like, for example, our website, or Public Health Ontario, or the Ministry of Health, or a medical journal, things like that? Or is it something that's on a website put together by anyone or put together by someone who may not have any background or any credibility on the topic? When you look at the website, look for things like .edu or .gov on the end of the website name. That corresponds to typically universities or academic institutions, as well as government sites. And those sites tend to be more reliable and more trustworthy with the information that they share. Finally, you can look at how current the information is. And is this information up to date, or is it something that was true a few months ago, may not be true now? As I mentioned at the beginning, information is changing very, very fast. We're constantly learning new things. We have to take new science in, and we're constantly adding that new science to our understanding of these vaccines and our understanding of COVID-19. And information that is up to date is going to be more useful, more trustworthy, more credible than information that's out of date. So please look at how recently the information was up to date, and that will help you understand how to use it. We have more information on our website about how to assess reliable vaccine information at those links on the page there, and we hope you check it out for more information. Finally, there are a number of things people can do to be vaccine champions for themselves, their families, their social circles, and their communities. We know that it's critically important for people to hear about getting the vaccine from people they know and people they trust. So we really encourage everyone to not only get the vaccine and get their family members to get the vaccine, but to talk with people around them, talk with their friends, talk with their neighbors, talk with everyone who they interact with about the importance of getting the vaccine, talking about how positive an experience it is, talking about how it can protect you to get the vaccine. There are a number of ways to share information about the vaccine online as well. We have a hashtag for you, for me, for WDG that you can use on social media. We have stickers that we give out in our clinics that we use to raise awareness of the importance of getting the vaccine and to help people start conversations with others about getting the vaccine. And it really helps for you to think about what your experiences were, why it was important for you to get the vaccine, and to share that information with others to help them think about why it would be important for them to get the vaccine. Ultimately, we want everyone to choose to get the vaccine, and people are more likely to choose to get the vaccine if they hear from someone they trust about why it's such a good choice for them. Finally, we in public health talk a lot about vaccines. we try to give credible information, we try to deliver it as clearly and effectively as possible, but we're just one body, we're just one group, and we're relying on everyone in the community to get the message out, to raise awareness of the vaccines, raise awareness of the importance of getting the vaccine, and to really promote the vaccine to everyone who they're in touch with. And so we're relying on you to help share this information and this message with everyone who you touch base with, so we can get the conversations going and get everyone thinking about the vaccine, so that eventually everyone can get the vaccine in one of our clinics. So please think about your role in this, because you can be an effective advocate for the vaccine for those who you see and who you talk to. And moving on to the next part, I did want to talk a little bit about some of the myths that exist around the vaccine, and perhaps bust some of those myths to help provide some credible information to counter some of the information that's out there that isn't so credible. The first myth we commonly hear about is the idea that genetic material in the COVID-19 vaccine can multiply in your body or stay in your body, or perhaps even change your DNA. And the fact of the matter is that this does not happen, and it cannot happen. The material in the vaccine is called mRNA, and it comes in your body from the vaccine, it does its job, and then it disappears. It's broken down by the machinery of your body. It sticks around for a very short time to do its job, but it does not stick around or do anything in the long term. As well, it does not interact with your DNA anywhere in your body, doesn't change your DNA, and it can't change your DNA based upon the way these things work. It only exists to help your body recognize the COVID-19 virus. It does that job, it does it well, and then it disappears from your body. Another interesting myth we sometimes hear about is the idea that the COVID-19 vaccine will make you magnetic because it contains some sort of metal content. And that actually isn't something that's true either. There are no metals or microchips in the vaccines, and they can't make you magnetic. They can't do anything that would involve metals. I've seen, for example, videos on YouTube of people taking a coin, they lick it, they stick it on their arm, and they use that to show that the vaccine must be magnetic because the metal coin is sticking to their arm. And things like that are kind of neat tricks that people can do because the skin is sticky and a coin will stick to your shoulder because it's sticky. There's something magnetic in the vaccine, and there's no metal in the vaccine that would cause it to happen. So take those YouTube videos with a grain of salt. That's not something that can actually happen with the vaccine. The next myth we hear about is the idea that the COVID-19 vaccine can cause infertility or miscarriage or other problems with reproduction and childbearing. And the fact is that everything we know right now about these vaccines indicates that there is no link between these vaccines and infertility or miscarriage or any of these reproductive or childbearing concerns. The way the vaccines work is that they are injected into your shoulder typically. That's where the vaccine is taken up. Your immune system recognizes it based upon the injection there, but you don't have anything that circulates down to your reproductive organs. And there's certainly been nothing in the clinical trials or any of our safety systems to indicate that it can cause any harm to your ability to conceive, your ability to have children, anything like that. It's a common myth, and we certainly understand the concern because these are fairly new vaccines, but I can reassure you that there's no safety concerns with these vaccines when it comes to anything on this dimension. Another thing we hear about sometimes is the idea that people who are vaccinated, that they can shed the virus or the proteins that the vaccine makes, and perhaps cause other people around them to be infected. And that is actually something that can't happen. When we give people the vaccine, we give them something that contains a little bit of a piece of the code for the virus so that your body's able to recognize a particular piece of it, but your body can't actually build the virus. And the vaccine cannot cause you to become infected with COVID-19. All it does is it helps you to realize what the virus looks like so that your immune system can train itself to recognize the real life virus. We're not giving people the virus. What we're doing is we're giving them some of the instructions of what the virus looks like so that your body knows how to recognize it. If I can use a metaphor that might make me look a little bit dated, it's sort of like a Snapchat. If you think about what the vaccine does, it delivers kind of a picture of what a piece of the virus looks like. That allows your body to read it. It knows what it looks like. It can train itself to recognize the real thing. Then just like a Snapchat message, that message disappears. It's broken down by your body, and it doesn't stay around for any length of time. It's only there long enough to help your body learn how to respond to the real thing, but it doesn't cause any infection, and you certainly can't pass anything on to anyone else after you get the vaccine. Another question or concern we hear sometimes is a question about whether or not corners have been cut in order to make sure we're able to develop the vaccine so quickly, given that usually vaccine development takes years. And it's true that usually vaccine development takes years. And if you think about how a vaccine is usually developed, usually there are many, many, many months of slow basic science work because we're starting from scratch. Then there's recruitment to these trials where they look at how safe these vaccines are, how effective they are. Manufacturers then submit data to Health Canada, and that takes time to work through its process at Health Canada. And these steps usually take a long time because there's a lot of waiting involved, a lot of paperwork involved, and these things, they just get gummed up in the process usually. Of course, given that COVID-19 is a global pandemic, a public health emergency, when governments realized that a vaccine was going to be our way out of the pandemic, they invested new resources in order to ensure that groups like Health Canada are able to review and approve vaccines quickly and safely. And Health Canada has been able to use processes where they're reviewing data as it comes in and taking certain steps that are happening one after another and doing them in parallel to really make sure that there's no unnecessary waiting in the process. But at the same time, all the key steps that ensure the vaccines are effective and that the vaccines are safe are all being done. No corners are being cut, but it's just really making sure the process is working at top speed as fast as possible, taking out any of the waste, given that we want to make sure we have vaccines available as soon as possible. It's really a reflection of the unprecedented nature of the pandemic, new resources that have been invested to make sure that Health Canada is able to review these vaccines, and some innovation in terms of the process to make sure that they're able to do it without any waste along the way. But again, all the steps to make sure that these vaccines are safe and effective have been followed with these vaccines as they are with any vaccines we use for any infections. So that brings us to the end of the myths section. I know that we have about an hour together overall, and I do want to make sure we have a chance to talk about questions you might have about the vaccines so that you feel comfortable with the vaccines and understanding everything you want to know to make the best choice for yourself and for your family. So I'll turn it back over to
Awesome. Thank you so much, Dr. Tenenbaum. So like Dr. T said, we had over 35 questions submitted in advance of this presentation. So thank you very much, everyone. I've done my best to go through and group the questions together. So the first question I have for you, you delved into it a bit, I believe, but maybe we can unpack it a bit further. Vaccination for kids that are younger than 12. When do we think a vaccine will be available? And how do we know it's going to be safe for those youth who are under 12?
A great question. So usually when it comes to a new vaccine, the first group of people who get the vaccine are adults. Typically that's because when the people who make the vaccines do their studies, they bring adults and they do the tests on adults because that's a convenient population and it's going to be the broadest section of our population overall. So when we first had these vaccines, they were approved for adults, and that's who we immunized first. But for example, with Pfizer, they did a follow-up study looking at people down to age 12. And based upon that follow-up study, which showed it was as safe and as effective for that age group, we've been able to expand the eligibility down to age 12. When it comes to younger age groups, we know that the vaccine manufacturers are doing further studies going down to younger age groups. We're hoping that we're going to hear more on the outcomes of those studies into the summer and perhaps in the fall have some approvals from Health Canada. We don't know with certainty, but we are hoping for some progress on this in the coming months that we can immunize people even younger than 12, assuming it is safe and effective to do so.
Awesome, thank you. So sort of tied into that is another question about age requirements. My child is turning 12 later this year, but the system won't let me register them for an appointment. When can I register them?
So that's a great question. So one of the things about that lower age limit of age 12 is it really is important that the person getting the vaccine has to actually be 12 years old. Unfortunately, people who are turning 12 this year can't get it. They actually have to be 12. And so as part of the process, we're saying that when you register, you have to make sure that you are actually 12 years old, as opposed to turning 12 later this year, just to make sure that whoever's getting the vaccine is getting it with the approved age group in mind.
Great. I have a question about the Moderna vaccine. The question is, will the eligibility for the Moderna vaccine be expanded to youth like Pfizer has been?
So we fully expect the answer will be yes. So we know that Moderna has done trials going down to age 12. Those trials have shown the vaccine to be as effective and as safe as it is in adults. They submitted that data to Health Canada, and that was just at the beginning of this month. We're hoping the Health Canada will review that data and perhaps provide an approval in the next few weeks.
Great. Question about school eligibility. So we have this question over and over again. Folks are concerned, will youth need the vaccine to be able to go to school in September?
So right now, we are really encouraging everyone who's eligible to get the vaccine to get at least one dose and hopefully 2 doses before the start of the school year next September. However, right now it is not a requirement in the way that some other vaccines are. We want to make sure the vaccine's as available as possible for everyone who's willing to receive it. And this may change. We might get further policy from the provincial government, but right now it is not a requirement for school to have had the COVID-19 vaccine.
Great. Another question is about, I've heard COVID-19 isn't as severe as it is in children. So why should I have my 12-year-old vaccinated? Is it worth the risk?
It's an excellent question. So we know that age is one of the major risk factors for COVID-19. And certainly people who are in their 70s or 80s or 90s, they are at greater risk for things like having to go to hospital than people who are in younger age groups. So we know that it is most important to get the vaccines to those older adults, and that's why they were immunized first. But we also know that younger people can still become sick. They can still go to hospital sometimes. And importantly, they can sometimes pass it on to other people around them. And so it is still important and beneficial for people in the younger age groups to get the vaccine to help stop transmission, to protect themselves and their families. And even though the benefit for them isn't quite as big as it would be if they were 70 or 80 or 90, that benefit is still much, much, much greater than any risk with the vaccines, which are really negligible at this point.
Thank you. Next up is a question about accessibility accommodations. So if a parent is bringing their child to one of our clinics, what types of accessibility accommodations might we provide, and how could they go about booking those?
So we have information on our website all about some of the accessibility concerns and how to access our clinics if you have particular accessibility needs. We do strive to make our clinics as accessible as possible, regardless of someone's accessibility need. And we have information about that on our website. And we also have information about that available over the phone. So if you have a particular need, you can give us a call and we can make sure that we sort that out with you.
Wonderful. Second dose timing. So we had a couple really specific ones here. One was my child got their first dose on May 22nd, but their second dose isn't scheduled till September 4th. Another one, their child got their vaccination on June the 4th, but didn't get their second dose appointment timing. So folks have heard that we really want to get those vaccines into arms before school starts again in September. So how will folks know when they're able to move up those appointments or rebook those second dose appointments?
It's a great question. And we know there's been a lot of change on this front as we get more and more vaccine supply. And as the provincial eligibility for vaccine shifts, we're shifting too. And shifting has been the name of the game when it comes to the vaccine rollout. So we know that it's critically important to get that first dose as soon as you can. And we mentioned earlier how to sign up for that. When it comes to your second dose, you may get a date for your second dose that's then later shifted, hopefully coming forward based upon increased capacity and increased supply. We are just saying that, we want to make sure we get everyone immunized if we can with a second dose, at least above age 12 before the start of the school year. If you have, for example, a date after the start of September, you may get that moved up. And the answer for right now is stay tuned. We will be in touch as we're able to move that up.
Great. I think that helps reassure lots of folks out there who are just anxious for that second dose, which is what we like to hear.
Yes.
Next up is there were a couple questions submitted about myocarditis and its link to mRNA vaccines. I wonder if you can unpack that for us all a little bit and help us to understand what we've been seeing on the news on that front lately.
Absolutely. This is actually a really hot topic, a really newsworthy topic. And going back a moment, whenever we roll out a vaccine, especially a new vaccine, we really want to make sure we have a strong safety system so that if there is any rare or unnoticed side effect or complication associated with the vaccines, we want to make sure we find that out, we understand it, we study it, and then we make further recommendations about how to change the vaccine rollout if we have to change it. So we have a whole system where anyone who has a problem after getting a vaccine, that gets reported to us at local public health. We connect with the province, with the country, and we bring all the data together, and we look for any what we call safety signals, any reasons that we might need to be concerned about anything that happens after the vaccine. When it comes to myocarditis and pericarditis, first off, those refer to inflammation of the heart or the lining of the heart. That's something that can be caused by infections. There are a number of causes for myocarditis and pericarditis that have nothing to do with vaccines. But there have been some reports of those things happening in people who got an mRNA vaccine like Pfizer or Moderna. Typically younger people, typically people who got it after a second dose, typically people who get a very, very mild case and do perfectly well. But we are aware of those reports. Our public health agency at the province, public health agency at the federal level, they are looking into this to understand whether this actually represents a true safety signal. We don't know yet this is actually something that is caused by or associated with the vaccine, but we do want to make sure we're asking that question. We don't want to ignore a possible safety concern. We want to make sure it's really investigated. And that's what the public health agencies are now doing, is investigating to make sure we understand this really well in order to make sure that we inform the vaccine rollout with that. What I can say is that people who have had it after the vaccine have been very mild cases, and people have done quite well despite that. We, of course, want to make sure we know more, though, and share that information as we receive it.
Wonderful. Next question. Is it called a vaccine? Is it called a shot? Is it called an inoculation? What terms are we meant to be using here?
Oh, we got tons of terminology in our vaccine world, and we feel like we talk about all these terms every single day in our public health offices. I guess typically the vaccine refers to the actual product. So the Pfizer vaccine, the Moderna vaccine, whatever the vaccine itself is a particular, I'm going to call it a product. That's how we typically use the word vaccine. Oftentimes when we talk about someone getting vaccinated with a vaccine, they're going to get one or more doses, and those doses are sometimes called shots or inoculations. So for example, with the Pfizer vaccine, you will get 2 shots or 2 inoculations in order to get the full benefit of that vaccine. Sometimes we use those terms a little bit imprecisely, but that's how we usually do it. And certainly vaccine terminology is something we're all becoming more acquainted to as we talk a whole lot more about vaccines than we usually do.
No kidding. I wondered if I could ask a question about the Delta variant. So we're hearing lots about that in the news. Can you speak to parents and youth on the call about what that variant is and how concerned should we be?
Absolutely. So the Delta variant is one of these so-called variants of concern. We've been dealing with variants of concern for a number of months now. Our 3rd wave in the province of Ontario was caused by a variant of concern that originated in the UK. The Delta variant is a different variant that originated in India. And essentially, these are versions of the COVID-19 virus that have had some changes, some mutations. They arise naturally, but they can cause the virus to either be more transmissible, spread more easily. Maybe they cause more severe illness, or what could be worrisome is perhaps some of these variants could evade the ability of vaccines to protect us. So the Delta variant is one that is a more recent variant, something we're talking about more recently. The reason we worry about it is that it spreads more easily than the COVID-19 we've been dealing with to date, and it spreads more easily than the so-called Alpha variant, the UK variant that really prompted our 3rd wave. Every time you have a version of COVID-19 that spreads more easily, it means that it can overtake the other COVID-19 and become the dominant strain. And of course, if it spreads more easily, it means we have to be that much more diligent with our public health measures like distancing, masking, staying home if we're sick, things like that. The good news that we have is that when it comes to the vaccines that we have available, it does look like 2 doses of these vaccines provide some really good protection against this variant. And so getting the vaccines that we've been talking about today are still the best thing you can do to provide the protection against the Delta variant, just as it is the best option for providing protection against any COVID-19. As far as what Delta could mean for us, it's something we have to be thoughtful about, careful about. We have to be vigilant about the possibility that it could spread more easily, and we don't want to relax public health measures without thinking too hard about it. But getting vaccinated is still the right choice, and these vaccines do provide excellent protection against this variant after 2 doses especially.
Thank you. We've also heard lots from parents about their concerns about their children's mental and physical health. So we're sort of moving into this summer of reopening now. Folks have more first doses, more second doses are on the way. What would you tell parents who are concerned about, how do I balance mental and physical health this summer with making sure I keep my kids safe?
And that is a really challenging thing. I know that especially with, schools have been closed for as long as they've been closed and a lot of restrictions on the kinds of activities kids can participate in. Kids have been lonely, kids have been isolated in many cases, and it is really difficult for kids to experience that, and that takes its toll. It takes its toll on the kids, takes its toll on the adults who live with the kids and care for the kids, and it has made dealing with this pandemic really challenging. We know that we can't relax things too easily. We have to make sure we're vigilant, as I mentioned, but we also talk in public health about safe ways to interact, safe ways to get together, and to really make sure that we're able to have that social connectedness with one another and allow that play and that flexibility in children's lives while still doing some common sense things to prevent the spread of COVID-19. So now that we're in the summer months, we have the benefit of having beautiful outdoor weather most days. We know that being outdoors is much, much, much lower risk for COVID-19 transmission than being indoors. So it is much better, for example, for kids to be able to interact with one another or play outdoors compared to being indoors. The common sense thing we talk about is spend as much time outdoors as you can. Either stay physically distanced, or if you're going to get closer than 2 meters, throw a mask on. But if you're outdoors and you're doing those things, the risk is still quite low. And it is important to balance that risk as it exists with the risks of mental health difficulty, the risks of isolation, and the impact that the pandemic has on children. So I don't want to say that we can completely go back to normal. There are still some things we want to do to make sure that we're staying protected and staying safe. But there are safe ways to interact, relatively speaking, especially when we take things outdoors. So that's something to think about as we head to the warmer weather up ahead.
For sure. And then a few parents asking you to kind of, I think, take a look into the crystal ball here and project what might they be planning for in the fall? What do you see in terms of school reopenings and our progression in the fall as we go through this? Obviously, all of it with a grain of salt, given that things change pretty quick around here.
Yeah, and I feel like I'll promise that whatever I say is guaranteed not to happen because there's so many unknowns, but I think there are a few trends we can keep our eyes on that we can use to inform our best predictions about what to expect. The question about the Delta variant and whether we'll have any further waves of COVID-19, of course, is a really hot issue. We haven't seen the increase in cases overall. Things are still coming down right now. But if we see increases or if we find that COVID is spreading again, we will have to make sure we take really diligent control measures to keep that from becoming a fourth wave and to make sure that we protect the summer and protect the fall as best we can. That's one significant unknown, but we're not yet at a point where we have evidence of a fourth wave. One thing we do know is that vaccinations are ramping up really fast. And while things were moving very slowly in the winter when vaccine supply was limited, we are now getting thousands of doses out every week. And we know that, based upon our current pace of vaccinations, based upon, what we expect as far as supply in July and August, by the time we hit September and the start of school, we will have a significant fraction of our population, not just immunized with 1 dose, but immunized with 2 doses. And we really hope that, Delta variant or not, that will make it much more difficult for COVID to spread and allow us to have perhaps a bit more normal fall than we had last fall. We don't know with certainty, and again, a lot of unknowns, but I'm anticipating that vaccines are going to make a huge difference. And that's part of why we're really encouraging and asking everyone who's eligible to get a vaccine this summer to get their first dose, get their second dose as soon as they can, because the sooner we get those population levels up, the better ability we'll have to control COVID overall, and the more normal our fall and winter will look.
On that note of more normal, I think we're seeing other areas across the world that might have been a little bit ahead of us in terms of vaccination start to change what they're doing. An example that's been given here is the CDC stepping back a couple of its masking recommendations. Do you see that kind of future for Canada?
I think so. And I think that as we get further into our immunization campaign and as more of our population gets 2 doses, we are going to see some further guidance coming out from the province, for example. about what you can or can't do when you're fully vaccinated that allows you to be a bit more normal in your life. We know that if you have 2 doses of vaccine, your likelihood of becoming sick with COVID is much, much, much lower. And also your risk of passing the virus on without symptoms is lower overall. And so the more people get vaccinated, the more that we can get individuals back to normal, but we can also get communities back to normal. And we are going to have more information on that guidance, I think, in the coming weeks, once more of our community has the 2 doses in their arms.
I think that makes a lot of sense. And where would you recommend that parents go for the most up-to-date information on this when they're looking for more information, not just about vaccination itself, but about reopening, keeping their kids safe this summer and into the fall? Any good tips for where parents can go?
This is going to be a bit shameless, but I always put a plug in for our public health website, wdgpublichealth.ca. We try and keep all of our pages on there up to date with whatever the latest news is, whatever the latest guidance is from the province or from the federal government. We try to make sure that we provide accurate, trustworthy, credible information to everyone who goes there with questions. We try to make it easy to read with frequently asked questions and make it your one-stop shop. We know that we're not the only game in town, and there are great resources from Public Health Ontario, from the Provincial Ministry of Health, from, for example, the University of Guelph, within Guelph. Like, there are great, credible resources out there with information about COVID-19. But we say your first stop should be our public health website, wdgpublichealth.ca.
Great. So I asked a couple of questions about timelines for when our 12-plussers are going to get vaccinated, but there are a couple questions in here about our teachers and our other school staff. So what are your projections for when those folks will see a second dose?
So over the course of the first dose rollout, teachers and school staff have been one of the prioritized groups of workers who have been getting their vaccine. We've been immunizing teachers and school staff for a couple months now. And we do know that it's critical to get as many school staff, teachers, and otherwise immunized with 2 doses before starting the school year this fall. We want to make sure we create as safe a school environment as we possibly can. And while vaccines aren't the only piece of that puzzle, they are a huge piece of that puzzle now that we have them as an option. So we do know that a lot of students, a lot of teachers, a lot of school staff in our community have already gotten vaccinated, and many more are going to be getting their vaccines in the coming weeks. And we are also going to be working to make sure they can get their second doses before the start of school, given the supply that we're expecting to come down the pipe.
Great. And then on the note of vaccines themselves, I think one thing that we didn't talk about in too much detail, but there are a couple questions asked, is what are the symptoms that I'm looking out for post-vaccination? So what are the side effects that I might be expecting, and what should I be worried about?
Great question. So we know that these vaccines, first of all, are safe. That being said, they can cause some side effects after you get them. Typical things are, pain at the shoulder where you got the injection might become a little bit red or swollen. Some people get muscle aches or joint aches, feel tired, might get a headache or get a little bit of a fever. Those are actually fairly common side effects, not just with these vaccines, but with other vaccines that we use. The reason that those side effects happen is because when you get a vaccine, you're trying to get the body's immune system to recognize what the virus looks like so it can learn. And the body's process of learning, building that immunity, is what can often cause those symptoms. A fever, for example, is caused by an activation of your body's immune system, and it can happen when you're infected, but it can also happen when you get a vaccine because it's still getting activated by that process. So it is pretty common for those things to come up in the first day or two after you get the vaccine. They are typically very mild or perhaps mild to moderate, and they usually go away within 2 or 3 days. It's unusual for it to go any longer than that, but these things are short-lived, they're manageable, and they're common. Things that might be reasons to be concerned is if, for example, you get a cough. A cough is not something that's a common side effect of a vaccine. And we want to, of course, maintain vigilance and think about possible symptoms of COVID-19. Whenever someone has one of those symptoms like a cough or difficulty breathing, you want to make sure they get a COVID-19 test just to make sure that those symptoms aren't being caused by the virus itself. It is unfortunately possible to get the virus before you get the vaccine and to only show the symptoms afterwards. So we want to make sure if you have any of those COVID-19 symptoms, you still get tested like you always would, because it takes some time for that vaccine to work. And you can, of course, be exposed before you get the vaccine. But things like muscle aches, joint aches, a little bit of fever, a little bit of fatigue, soreness at the arm when you got the injection, those things are common. and they're typically very short-lived and very mild.
Awesome. Can you talk about how frequently it would happen that someone would be fully vaccinated, 7 days post the second dose and still develop COVID-19?
Sure. So what we know is that these vaccines are incredibly effective, and they significantly reduce your risk of getting ill with COVID-19. We know that nothing is perfect, and no vaccine is ever 100% effective. But we're talking about vaccines that are well over 90% effective. And what that means, whether we're talking about 2 doses of Pfizer or 2 doses of Moderna, is that whatever your risk would be given an exposure, it comes down by 90% or more, which is huge. It makes a huge difference to your level of risk and your likelihood of becoming symptomatic, your likelihood of having COVID-19 you can pass to others. So it is possible to get COVID-19 after you get the vaccine, but it significantly reduces your risk. Anyone who gets the vaccine, we still say if you have COVID symptoms, it is worth getting a test just to make sure it isn't being caused by the virus, because it's possible to get COVID-19. Nothing is 100%, but it is a very, very, very unlikely to get COVID-19 after getting 2 doses of the vaccine, because it reduces your risk by over 90% based upon the best data we have.
Okay. I have another question here that's sort of more talking about vaccination on a global scale. So we've all sort of been watching the G7 summit that's happening just in our backyard over there in Cornwall. And they're talking lots about national allocations of vaccines to other parts of the globe. Can you talk about why that's necessary and why maybe we're not totally focused on getting just our country 100% vaccinated?
Absolutely. So that's a great question, and it kind of reflects on the fact that we're in a pandemic. We have an epidemic of COVID-19 in WDG, and in Ontario and in Canada, but really this is happening all over the world. COVID-19 is spreading in most every country. It is something that can travel from country to country because people travel still by air, by land, over international borders. And as long as COVID-19 exists anywhere, it is a threat everywhere. Even if we got everyone immunized in Canada who could get a vaccine, because it's not a perfect protection, the level of risk globally still matters. And we know that we can protect WDG residents, Ontarians, Canadians by getting rates down and getting vaccines into arms in places like Brazil and India. We know that places that are having significant surges in COVID-19, they can be places where it's likely for these new variants to arise, because the more people who are infected, the greater the odds are that COVID-19 can change and perhaps become a new variant. And so the better job we can do to get it under control globally, the safer we will be in Canada, and also the more normal our lives can be. If we have COVID-19 raging around the world, then we're not going to be able to do things like travel. We're going to have border restrictions, and we're not going to have the normal life that I know we all yearn for. So it is critically important for us to get this thing controlled everywhere in the world. And it's important for us to get vaccines everywhere to help control that effort. Vaccines aren't the only piece of the puzzle, but they matter a lot. And vaccines delivered elsewhere in the world do protect us here.
Great, absolutely. So in our last 4 minutes or so, I think I'll hand it over to you to close things up. I think my last question here would be, what is our overall take-home message for parents and youth who are tuning in with us today?
Thanks, Anna. Thanks everyone again for making the time to spend about an hour with us today. So hopefully over the course of this time, you had a chance to get some information that you feel you can trust about the COVID-19 vaccines, understand why we're so thrilled about them, understand why we're offering them to everyone who's eligible, and understand why getting vaccines into arms offers that person protection, but also offers our community protection and creates an overall safer environment that will eventually allow us to get back to normal. So what I hope people take away is that these are effective and safe vaccines. They're vaccines that you can trust, and that we in public health are working constantly to make sure that we can trust these vaccines, make sure we understand them, and make sure we're providing you with the best guidance. We wouldn't offer you a vaccine if we didn't believe it was safe and effective, and we didn't believe it was the right choice for you and your family. Again, we're in a really privileged place right now to have as many doses coming into our community as we do, and we're able to really ramp up and offer them to many more groups than we were previously able to. We want to make sure you know how to access the vaccine, know where to go to pre-register, know your options for getting it in a clinic run by our public health unit versus a partner clinic versus a pharmacy or a primary care office. We want you to know where you can get access to the vaccine so that you're able to get it as easily and with as little hassle as possible. And finally, I want to make sure you know where you can get more information. So hopefully you get some information here tonight, but I know there's going to be more questions you have after tonight that you might find answers for on our website, wdgpublichealth.ca. We constantly keep those resources up to date, and we link out to other resources that are credible and trustworthy with vaccine information. All of these things are changing week by week, and whatever is new today is going to be old hat by tomorrow. So please do stay engaged, do stay interested, ask questions, get answered, and make the right choice for yourself and your family. So again,
Thank you so much
for making the time tonight, and hopefully this was helpful. And if you need more from us, please go to our website. We have a lot more information there.
Wonderful. Well, thanks everyone. I will be sending out this recording following the meeting in the next several days. So if you need to review anything, you can do that as well. Thanks so much, and everyone have a great evening.
Thank you, everyone.